Welcome to another chapter of Insurance ASMR Bedtime Stories by Core Insurance Services, where we believe peace of mind is built one gentle truth at a time. Take a slow breath in and let it drift out. If you listened to episode 2, The Ones Who Carry the Promise, you already know how Medicare began. Tonight, we open the curtain to see who keeps that promise alive. In 1965, President Lyndon B. Johnson signed Medicare into law, handing the very first card to Harry S. Truman, a quiet thank you for the dream he began. Since then, new chapters have been written. Part C, Medicare Advantage. Part D, prescription coverage. Each letter, a response to someone's need. Every reform, a new way of saying, we still believe in care that lasts a lifetime. Behind the name Medicare is an orchestra of hands. At CMS, policy analysts adjust regulations line by line. At Social Security, files merge with lives, numbers turning into names, names turning into benefits. Far away, call center reps answer softly lit phones. Yes, ma'am, I can help you with that. Keystrokes echo like rainfall. Another application complete. Insurance carriers upload plan data, actuaries measure risk, and compliance teams proof every paragraph, so that when your card arrives, it carries the weight of design and intention. A system built to help even as it strains to keep up. And then there are the license agents, people who study, recertify, and listen. We review formularies so you don't have to. We interpret deductibles and drug tiers so peace replaces panic. We are translators of fine print, bridges between language and comfort. Every autumn, we study new rules, not for applause, but to protect the people who trust us. Even with all this structure and care, Medicare still confuses people, and it's easy to see why. The quiet myths that drift between conversations pass along like whispers over coffee tables and waiting rooms. Some are half true, some were once right, but changed with time, and some simply grew from confusion. Part letters mix with plan names. Rules change each year, and the difference between what's covered and what's included can blur overnight. So, before myths spread further, let's take a moment to sort fact from fiction. Myth 1. Medicare is free. In truth, every promise needs upkeep. When Medicare was created in 1965, it was designed as a shared system between the government and the people it serves. Part A, hospital insurance, was funded through payroll taxes, paid quietly over decades of working years. And that's why most people don't pay for it later. But Part B, which covers doctor's visits, outpatient care, and preventative screenings, was built differently. It's optional, and it runs on shared contribution. About 3 parts paid by the government and 1 part by the people who use it. Your monthly premium isn't a penalty. It's a portion of the cost that keeps the system alive. A reminder that care, like trust, works best when it's shared. Myth 2. I don't need Part B. In truth, choosing to skip Part B can seem harmless in the moment, especially if you're still working or covered by your spouse's employer plan. But once that coverage ends, there are strict timelines to enroll without a penalty. For every year you delay, the premium can rise permanently. So while waiting might save a few dollars today, it can cost much more later. Myth 3. Agents charge fees. In truth, certified agents are paid by carriers, not by you. That means whether you choose Plan A or Plan B, you pay the same premium you'd pay alone. The only difference is that with an agent, you also get explanation, follow-up, and someone to call when letters don't make sense. We're licensed, trained, and monitored by CMS to make sure we serve you, not ourselves. Myth 4. You can't change plans. In truth, each year brings open enrollment, a short window to adjust coverage. Life changes, prescriptions change, and what worked last year might not fit this one. That's why this season exists, to give everyone the freedom to realign protection with reality. There are even special enrollment periods for those who move, retire, or lose coverage. Medicare is built on choice. You just have to know when to make it. Myth 5. All plans are the same. In truth, every plan has a different network, different pharmacy contracts, and different costs for the same medication. A $0 plan in one county can cost $35 in another. The details decide your comfort, and those details change yearly. That's why reviewing your plan, especially with a certified agent, isn't nagging paperwork, it's protecting your peace of mind. Myth 6. You must keep the same doctor forever. In truth, Medicare was built on freedom of choice. You can change providers or plans if your needs or location change. Some plans limit networks. Others, like Original Medicare, let you see any doctor who accepts it. The key is knowing your type of coverage before you make a switch. Myth 7. Medicare covers everything. In truth, it doesn't, and that's one of the most common shocks. There's no routine dental, vision, or hearing coverage under Original Medicare. That's why many people add supplement or advantage plans to fill those gaps. It's not failure, it's design. The original law covered hospital and medical needs, not the full picture of wellness. That part is up to you to complete. Myth 8. Once you're on Medicare, you can relax forever. In truth, coverage is steady, but plans, medications, and costs shift every year. Staying informed isn't anxiety, it's self-care. A few minutes each fall can save hundreds over time and make sure your doctors, prescriptions, and peace of mind still align. I can't emphasize enough how helpful a certified Medicare agent is in this process. Myth 9. Medicare and Medicaid are the same. In truth, they share a name but serve different purposes. Medicare is federal for those 65 or older or living with certain disabilities. Medicaid is state-run for those with limited income or resources. Some people have both. They're called dual eligible, and that combination can unlock special coverage options like PACE programs. When myths fade, peace of mind grows. Each fall, envelopes arrive, plans change, and it's time to check in again. This isn't just paperwork, it's an annual health review, a moment to look at what's changed, your doctor's prescriptions, any new diagnoses or treatments, because your coverage should fit your life as it is today, not the way it was last year. Reach out to your licensed Medicare agent to review your plan, discuss any updates to your health, and confirm your coverage still matches your needs. And remember, you don't have to wait for fall. If you newly qualify for Medicaid at any point, you call your agent right away. You may become dual eligible, Medicare and Medicaid, which usually gives you year-round special enrollment flexibility. After one change per quarter in the first 3 quarters, to move into a plan that better fits your benefits, meds, and doctor. A short call now can save months of confusion later. The rustle of paper, the click of confirmation, the moment you know you're covered, that is a sound of security renewed. You don't need to know everything, you just need someone who listens, someone certified, patient, and present. Medicare is not a maze, it's a map, and with the right guide, you can walk it in peace. This story is for educational purposes only and does not replace personalized advice. Plan options and eligibility varies by state and carrier, and Medicare rules can change from year to year. For guidance specific to your situation, contact a licensed Medicare agent or call 1-800-MEDICARE, 1-800-633-4227. If this episode of Insurance ASMR Bedtime Stories by Core Insurance Services brought you a little peace, there's a whole playlist of stories much like this one. Please like and subscribe for more gentle chapters and to be notified when new stories arrive. Thank you.